diabetes is predictable. Now, if I say diabetes is predictable, maybe you may be thinking that the best thing to predict diabetes is to check our genetics, or whether somebody in my ancestry, like in my maternal ancestry or paternal ancestry, is having diabetes. Now, of course, genes has got a role in predicting diabetes, but it's very, very small, very thin line. The majority of the contribution to have diabetes is not in the genes, but it's in our environment. I mean, the diet, the lifestyle, the routine that we follow is the one that is really making a person diabetic. In functional medicine, there is a saying, genetics loads the gun, and it is actually the environment or the lifestyle that triggers the gun. So please know that diabetes is absolutely predictable. Now, we have in our country, in our general living, we have a lot of predictable things happening. We can predict earthquake, we can predict cyclone, or we can predict floods. But why can't we predict diabetes? Diabetes is predictable. How? The best or the most popular method to predict diabetes is to check the insulin levels in the blood. It should be a fasting insulin levels, or it can be insulin levels after the food. And the second marker is called HOMA-IR. HOMA-IR is a calculation of fasting blood sugar and fasting insulin. You can reach out to a laboratory, a good quality laboratory in your neighborhood, and please check your fasting insulin levels and HOMA-IR. And this can be one of the best methods to predict diabetes. So isn't it good news that we can know diabetes at least 5 to 10 years before? Point number 2, diabetes is a slow serial killer. Now, just because diabetes is almost present everywhere, you look around, many people have diabetes. So it is because of the commonality of this problem. Most of the time, people think that no, it's not that something's really serious into that. Just imagine electricity went off in your home. But suppose if you look around, all the households around you, they also have a similar situation. They don't have current. We feel like that, oh, it's very common. It's okay to have no current. The same thing is applicable to diabetes also. So since a majority of the population we look around, many of the households, somebody in that every family is having diabetes or similar kind of a disease, we think that it's nothing serious. I know we have a lot of diabetologists, we have doctors of medicines, so we can deal with that. Any HbA1c value above 5.7, even without medication, is something very, very serious. And most of the time in my practice, I get really surprised when people with A1C above 7 or above 8, even with medications, they take this whole scenario very, very casually. And this is something very serious because, as I said, it's a slow killer disease. Diabetes, it can affect each and every cell, every organ, and it can affect the whole body. And it's a very slow process, and it is this slowness that takes the seriousness out of that. I normally compare this with something called boiling a frog. Just imagine you boil some water, and if you put the frog in that water, the frog can immediately sensitize that it's very hot and this can really kill me. So it will jump out of that boiling water. But in a very cold water, if you put a frog and start boiling, in a very slow pace, the frog won't be able to realize that its life is in danger. Almost diabetes is similar kind of a situation. Now, diabetes sucks your life. Let me repeat, it sucks your life. It takes life out of you in a very slow way. So please, if you have an A1C above 5.7, even without medication, you have to be really serious about diabetes. Point number 3, it's a very good news. Diabetes is reversible. Almost more than 80% of the diabetic conditions, I am talking about type 2 diabetes, condition prevailing in the society, it is reversible. This is not a new news because just go through all the scientific literatures coming up in the last decade regarding reversal of diabetes. Now, in Harmony, we make use of all those scientific modalities, and we have designed a triangular pyramid format which has 4 cornerstones of reversing diabetes. It starts with nutrition, muscles, mind, and sleep. if we can comprehensively work on all these kind of things, step by step, you can reverse this metabolic condition. Now, there is no shortcut and there is no single drug or a new medicine that can reverse diabetes. It is absolutely, you will have to work on your lifestyle. Now, many times I have felt that, if there is too much of dependency on these hypoglycemic drugs and insulin. Just imagine if we are not, if insulin is not available from tomorrow, if all these drugs are not available from tomorrow. It's a hypothetical question, but still it's very important. If these drugs or insulin is not available, you will solely depend upon all those lifestyle modifications. And I have seen in many of our patients, we convince them that you can start working on their lifestyle so that you can bring down the levels of their medication, and it really happens. And sometimes the patient and the doctor also get confused. And many times the conventional diabetologists advise them to go back to the original diet so that the medications levels can be maintained. So diabetes can be reversed. It's an absolutely exciting news of this decade. I am not an endocrinologist or a diabetologist. My core area is nutrition, functional medicine, health coaching, and public health. But still, one thing that I've learned in the last 10-15 years is that, of course, the diabetologist learns a lot about diabetes, its pathophysiology and all those kind of things. But I personally feel that a diabetic patient or the person with diabetic symptoms should get educated on diabetes. He should be thorough with diabetes, how diabetes evolved, and what are the basic things that is happening in our body. And that knowledge is very, very, very powerful. So in Harmony, we educate, we take time, we take patience, we use all kind of teaching and training tools to convince, to educate the client. And if you are logically convinced about diabetes, now you'll be really motivated to make modifications in your lifestyle. And I can share hundreds of these kind of stories wherein people have worked on their basic simple dietary changes, adding lot of muscles through right kind of exercise, other disciplines in their life like respecting sleep, respecting our mental health, respecting our emotions. And I have seen people absolutely amazed, or I can say that it's really a surprise that their metabolism is back into shape and they reverse diabetes.